Hi, Mary. Thank you so much for coming in today. My name is Carlos Quiroz, and I'm going to be your counselor. I know we are here to talk about the tobacco use, and I want to help you understand what it does to the body, why it can be so difficult to quit for some people, and how we can work together to reduce harm. Let's take this step by step, and if you have any questions along the way, please let me know so we can address them. First, I want to talk about the drug classification and its effects. Tobacco is classified as a stimulant because of nicotine. That's the main active ingredient. It speeds up the central nervous system. This is why many people feel more alert or focused after smoking a cigarette. However, tobacco also has the depressant effects, meaning it can create a sense of relaxation or stress relief. That's why some people use it to manage anxiety or stress, or when they feel nervous about something or excited, they also smoke. The effect of nicotine kicks in very quick. Usually within seconds of inhaling, smokers feel the effects. Sorry. It increases heart rate and blood pressure, which can feel energizing, but over time, long-term tobacco use leads to serious health risks. Smoking is linked to a lung cancer, heart disease, trachea cancer, and chronic respiratory illnesses like COPD. COPD stands for chronic obstructive pulmonary disease. There's also the risk of secondhand smoke harming your family and those around you. Second of all, I want to talk to you about the drug use and dependence. Tobacco is one of the most addictive substances because nicotine affects the brain's reward system. What I mean by this is when you smoke, nicotine triggers dopamine release. Your brain releases dopamine. So that is the same feel-good chemical involving pleasure and motivation. This creates a cycle of dependence where your body starts craving it and it creates that dopamine hit often. Over time, as your body gets used to the dopamine hit, tolerance develops, meaning that you need more nicotine to get the same effect, as usually happens with all drugs. If you try to stop, withdrawal symptoms like irritability, anxiety, restlessness, and difficulty concentrating can make it really tough to quit. It's very hard for some people to quit smoking. Now, I want to tell you, there are some good news. And the good news is that there are multiple ways to manage these cravings, and you don't have to do it alone. Finally, I want to talk to you about harm reduction, and I will explain in detail for you. I hope that everything is clear so far. Harm reduction. I understand that quitting cold turkey can be really difficult and challenging for some people, and that's where harm reduction comes in handy. Harm reduction means taking steps to minimize the risks of tobacco use, even if you're not ready to quit it completely. For example, switching to nicotine replacement therapy and RT, like patches or gum, can help reduce the cravings without the harmful chemicals in cigarettes. If you smoke, you can also try cutting down the number of cigarettes per day gradually rather than stopping suddenly, because you know the withdrawal effects can be harmful to you as well. Using filters or switching to low nicotine products can also slightly reduce harm through quitting remains the safest option. Though, I want to tell you that the goal is progress, not perfection, and every small challenge helps to achieve the goal you have in mind. So now I would like to tell you about some current concurrent disorders and considerations. Let's talk about how mental health can play a role in tobacco use. Many people who use tobacco also struggle with mental health challenges like anxiety, depression, or PTSD. This is called a concurrent disorder. When a substance use issue coexists with a mental health condition, they are both together, it's called concurrent disorder. Nicotine can sometimes provide temporary relief from anxiety or stress or depression, but that is a short-term fix. Over time, smoking can make anxiety worse because of withdrawal symptoms and the impact of overall health. The cycle of dependence can also contribute to feelings of frustration or hopelessness. The key here is to find healthier coping strategies or mechanisms like counseling, mindfulness techniques, or even physical activity. All these can help manage stress in a way that doesn't rely on tobacco. Let me tell you that quitting or reducing tobacco use is a journey, and you don't have to do it alone. There are resources available to help. For example, we have Smokers Helpline in Ontario that offers free support, quit plans, and counseling. We have CAMH or CAM, Nicotine Dependence Clinic. This provides medical support and behavioral therapy for quitting smoking. And also you have the Ontario Drug Benefit, ODB. This is a program that can help cover the cost of nicotine replacement therapies if you are eligible. If you are open to it, we can create a plan together that fits your goals and needs and your lifestyle. What do you think would be a good first step for you? When do we start? Where you see yourself starting at this point? Thank you so much.